Didn't realize until I started doing a little bit more work on myself that everything I had been feeling in high school and below or college was actually not normal at all. I was just used to it.
Welcome to Beyond the Reps, where we talk about all things your physical therapist and trainer forgot to tell you. I'm one of your hosts, Whitney Stevenson. I am a gym owner, a celebrity trainer, and a personal training coach.
And I'm Dr. Hanna Shays, your co-host. I'm a physical therapist and practice owner.
All right, guys, welcome back. Episode number 10. Today, we're going to be talking about hard things and this idea that we can do things in our life that are hard. And in doing so, tackling this hard thing is, going to be good for us. It's going to better our life. It's going to improve our health and our existence. It's, maybe the good side of this whole hustle culture that we live in. But we're also going to be talking about discerning what actually is hard and understanding what is the hard thing that we need to be stepping into first. If we can discern where to begin with the hard and what exactly the hard thing is for us or for myself, like uniquely and individually for me, then I can do more for my health. And what I think is really amazing is that we have a real life example of this with Dr. Hanna's own personal health journey. This is going to include a mix of orthopedic pain, gut healing, hormonal healing, nervous system health. She has run the gamut and been a really good advocate for herself in going through this healing journey. So without an introduction, but with an introduction, Dr. Hanna Shays is obviously the co-host of this podcast. She's my esteemed colleague and the local on-site physical therapist for Sunmade Fitness. And she's my good friend and my teammate. And like I said earlier, she's an advocate for health and wellness and for it being a personal journey and a way of self-exploration. So she has shared many of her learnings with me in our partnership and working with clients and continuously working on ourselves that have actually made a difference because they are authentic learnings that she discovered by going down this, health journey road on her own. So this has kind of helped shape how we've even treated clients, how we've talked to clients, when things aren't working for somebody, when things aren't working for ourselves. And we're gonna run that gamut today. We're gonna go over all things like what went wrong with Hannah's, health, how it began, and we're just gonna talk about her whole journey. And I'm just so excited. I can't wait for you to share with everyone.
This is going to be so raw. And it's probably going to be two parts because, this is like ongoing and years of various things.
Yeah, but I think this is honestly at least when I'm listening to a podcast, I love hearing like a firsthand experience. I love hearing somebody's authentic journey through something, not just like, well, I read this book and this document said this and this said that. Because like some of that stuff is stale on me and it doesn't always work for everyone. And I'm not saying like what worked for you will work for anyone going through a health journey, but if anything, they can look at how you were an advocate for yourself and you went and looked at all these other things, not just like this one little issue.
And like I made it out to the other side. Feeling like there wasn't a light at the end of the tunnel with certain things because you've never been through it. And then you can look back and be like, oh my God, I made it.
You made it.
It's not an issue anymore.
Yeah. Or if it is, you know how to deal with it. You have like tools in your toolbox now, which is something that I think this could be a great addition for anyone to like who's listening to this is to just take some of these tools and put them in your toolbox. I know that's what even just working with you, it's something that I do. Clearly, texting you like the histamine pill, like, what are these supplements you recommend? And I think it's always good to look at things as, like you said, with a holistic approach, but also, if something is affecting one part of your body, it might be coming from somewhere else or it might be affecting another area. So I love that you and we get to talk about that today as we dive in.
Excited.
I know. All right. So like I said, we're just going to get right into it. When did you first realize that something in your health was not going right?
So for me, I basically hit a wall in 2020.
Okay.
That was just major stress. I was getting rosacea on my face, the skin inflammation, not like the pimple kind, but just the redness. because I was working in a hospital and we had to wear face masks, and I was actually getting broken blood vessels along the lines of the top of the mask.
Wow.
And I would look at my face and be like, do I have rosacea? What is that? Are those broken blood vessels?
Yeah, were you like, was part of this like, oh, COVID is happening, so maybe this is like a symptom of just wearing the mask, or...
Yeah, at first I thought it was just like the mask was, it was causing skin irritation.
Yeah.
I had to wear it all day, like for a long time.
Yeah.
But I was also starting to get styes in my eyes, and I hadn't really had styes before. And then I was getting like the styes that weren't just on the outside, but like inside the meibomian gland of your eye that makes the oil. And then my eyes were getting really dry. And so that was the wall that I hit, where it was just like I was miserable. I was stressed out all the time. And we'll get into more details of like what was going on and all of that. But that was 2020 was when I pulled back the health curtain and kind of realized, oh, this has been going on much longer than just right now. It all built up to this because of childhood habits, like diet, stress patterns, overworking. And I think I also realized that I actually wasn't as healthy as I thought I was when I was a kid, because I looked healthy and I played sports.
Active. Yeah, you were active.
I think I felt fine. I didn't go to the hospital, so I must have been fine. I must have been healthy. So 2020 was the tip of the iceberg.
Exactly. So you're at the top, and you're actually like, it's not the tip that's really like the cause. Like that's just a piece of it, right? And it's like this big thing that's like underwater that you don't even really see. An iceberg is such a good example of like what it really is.
That we're talking about that picture of, you see the iceberg that's visible above the ocean, but then the massive part of the iceberg that is like under the water.
And
if you guys have seen that image,
that's like what's really causing the issue.
Yeah,
not
everything's
like this
hidden under the water.
And it's so interesting that, how old were you in 2020?
I was 26.
Okay, so you're
which is still a healthy age.
It is.
Nothing really, air quotes, breaks when you're 26. People think you break in your 30s, But no, I think I broke 40s. When I was like 24, 25.
Yeah, so you're having this like, you're having these, symptoms come up, and it's kind of like you're in this gray area of like, oh, like, is this really affecting me? Is this not affecting me? Am I being like a baby about this? Or like, what's really going on? Because I think, for a lot of us who grew up in, around the time that we grew up, it was sort of like, well, you're fine, so just keep going. Like, if you were fine, you were good. It's not like, oh, I'm feeling great. It's like, well, I'm feeling good enough to do this. Like, you were feeling good enough every day to show up to work, but it's like, you weren't really feeling good enough. You know what I mean? Like, you just kept like pushing through. And it's kind of, it's interesting now we're in this like time of becoming overly aware of the things that are going on with people, and that can like stifle them or fear them from actually put fear into them from like going out and doing something. And really it's just kind of like, what is actually, how should I be feeling? And you may have been coming from a place of feeling unhealthy for such a long time, like you couldn't navigate that.
Nobody knows what they're feeling. Like, I've even learned this when I'm working with patients or certain patients. Like, where are you feeling this? Do you feel this here? I don't know. It's like, what do you mean you don't know?
Yeah.
Like, you don't know what you're feeling, because I don't know that we've been taught. We were conditioned to just not even pay attention to what we're feeling. Like, we put shoes on from a young age. We don't know what it feels like to stand properly or feel the ground through our feet. We don't know if we've been bloated our whole lives since a baby, having like formula or whatever, eating food you shouldn't be eating because you're sensitive, but nobody knows. So you've been bloated forever. You don't know that that's how you feel.
Yeah.
Like, well, so that's normal. Or if you have brain fog, people don't know until you don't have it anymore.
Yeah.
So I think for me, it was just like, I didn't realize until I started doing a little bit more work on myself that everything I had been feeling in high school and below or college was actually not normal at all. I was just used to it.
Yeah. What were some of those things that would like come up for you before? Like, were you sick all the time, or like how are you feeling?
Yeah. So when I pull back the curtain now and I kind of reflect on what my childhood was like, I was sick a lot, and it wasn't like going to the hospital or anything, and mostly I felt fine. So when I wasn't sick, I felt fine, but I would get colds all the time.
Fine, like good fine, or fine like...
Yeah, I wouldn't say I really even felt bad. Like some people reflect and say, oh, I felt bad and there was mold in the house. Like we didn't have anything like that.
Yeah.
So I felt fine. I never really felt bad. I slept fine. I had energy, but I would get sick frequently, like colds or norovirus if something was going around school or whatever, I would get sick. Like I got sick a lot more than I should. I had strep throat a lot. I still have my tonsils, but I had strep throat a lot. My illness and coughs would linger. So say nowadays, like most people, if you're clearing a cold pretty well, you'll be sick for like not even a week, and then the symptoms are done.
Yeah.
There's not a lingering cough or buildup. And I would have a cough that would just linger. And actually at baseline when I wasn't sick, I just had a dry cough all the time.
Wow.
Like just like that, like all the time before bed and during sports. And that was because I was getting a runny nose when I would eat foods I was sensitive to, which I didn't know at the time.
It was actually a food symptom.
A gut
symptom.
Not really food allergy, but maybe a little bit of a minor food allergy. So like I wasn't congested all the time. I didn't have environmental allergies, but it was food mediated. So my nose would run when I would eat certain foods, but because it was building up all the time and I never got relief, my nose basically ran all the time when I would eat out because there's gluten in everything.
Yeah.
Or when I would eat certain things at home, pretty much everything. Then I would have I would have mucus just kind of going around when I was playing soccer. So my nose was always running, and that makes you have to cough because you're always trying to clear something, or you get postnasal drip. So I had like a dry cough all the time, which now I know is food sensitivities. I was eating, now I look back, I was eating a lot of sugar, like, I don't know, upwards of like 200 grams a day.
Insane.
Probably more.
Like to think about,
because you don't know what's in a cookie. You eat a cookie, but like you don't really know what's in that, how much sugar is in the amount you're eating,
what
right?
high school student eats one cookie? No. Like I had 3 every lunch. Like that was a staple, the 3 cookies for $1.
Yeah. And I would have like brain fog after lunch in math class. So because I would eat gluten all the time. I played sports. So it'd be like 1 p.m. I'd be in math class and I'd be like, oh man, I feel like I need to take a nap. But that was just the brain fog. I wasn't totally fatigued. I was also bloated all the time, and I didn't feel bad. I didn't know that was an issue. So I was just bloated all the time. I had anxiety as a kid. I'm not sure if that was all, caused by food or anything, but I had anxiety. I still have anxiety. I had skin issues. So I had inflammatory skin issues. I had seborrheic dermatitis, which is fungal or yeast mediated, like from the microbiome on your skin, some eczema, and then on and off it's called tinea versicolor. So that's also like yeast or fungal mediated overgrowth from like sugar or certain things you're eating. And if you go out into the sun and you get a tan on your, it's usually on your trunk. So on your stomach or your back, your tan is splotchy.
It's blotchy, yeah.
You get like the white patches. It's like this weird splotched tan. I on and off had that.
It looks like your like melanin is leaving.
Yeah, kind of. And then in high school, I didn't find this out till later, so we'll talk about that. But I had endometriosis and I didn't know it. And then also went pretty much high school with sports recruiting. I think my adrenals just gave out on me. I was just wired and tired. And
going through the recruiting
chronic
process
insomnia
is hard. For anyone who is, and you're also going through puberty. So it's kind of like you're in this place where all of these symptoms were masked because you had this excuse of like, well, she's being recruited and that's kind of stressful. And also she's like, going through puberty. So this could be the reason why your skin's doing this, or you're feeling so tired, or why you're feeling anxious. And not necessarily, it's almost like we have this boundary of like, okay, things need to be this bad for us to really look into it. And if they're not there, then just keep living your life. It's kind of weird. It's a good thing and a bad thing. And I also think too, because you were an athlete and we grew up in this time of like, if you were skinny and active, you're healthy. Like that was it. Like there was no other, like skinny and active could have been eating disorder. Like it could have been so many different things. And the perception in the era that we grew up in was, if you are skinny and active, then you're healthy. And like
and whatever get as much calories in as like you burn, and then you're fine. It doesn't matter like where the calories are coming from. So like, carrots and apples versus like pizza. They're all calories. Yeah. That's kind of how I feel like I understood it in high school.
Yeah, that's how, we, not to talk about like food being evil or anything, but the food quality was not necessarily like
it was about
the hot topic of conversation.
The number of the calories.
No, I had
not
like
the quality
red dye
of the
40
food.
lunch. I had Gushers and like who even knows what was in that lunch pail? I don't even know. But yeah, it was not like at the forefront of, food quality was not at the forefront of the conversation.
That was when everything had to be fat-free and fat was being demonized.
Yes,
and salt was demonized.
Exactly.
And I don't think anyone talked about sugar, really.
No, not until it really bounced back and then everyone went Atkins.
When was that?
Atkins was like early 2000s and it was like the no sugar diet.
Okay.
It was like the no sugar, no fat diet. I think it was.
Yeah. So for me, most of this conversation, I was born in 1994, but a lot of this conversation is pretty much early 2000s and beyond.
Yeah. And up until probably 2015-ish. And, things have shifted since, dramatically since, our era in high school. And I'm older than you, so mine was even a little bit more strange, but.
Well, I don't even know what the food pyramid looks like now because I don't look at it, I don't bother to, but I remember when we were in school, the food pyramid was, the bottom of the pyramid was all bread.
It's all bread.
You need to get this, it should prioritize bread, cereal, and wheat. And guess what? I'm gluten sensitive. So
that's really hard. That's really hard.
So yeah, in general, I would say I felt fine. The sickness was colds. I was not like a chronically ill child every day. I was sick type thing. I made it through with the coughing. I played my sports through illness. I felt okay. I just did it. My grades were fine. I was sleeping fine. So yeah, like we said, when you're young, you assume you're healthy. If you're skinny, you don't gain weight. You can eat whatever you want. There's no negative consequences, right? Wrong. I think it was really just a testament to my genetics and just playing sports every day. I think that's really to a level, there's a certain amount of weight you will or won't gain based on genetics as well. And I don't think I really can gain more than a certain amount of weight in certain parts. But that doesn't mean that there's not blood sugar swings and low levels of insulin sensitivity happening. There are really skinny people that develop type 2 diabetes too. So
yeah. And some of the things that you were saying about food, and obviously even I was even, subject to this too, but when food is molecularly structured to taste a certain way, like fast food or cookies or anything with sugar in it, it's going to taste good and it's going to trigger a reaction in your brain to you want more of that. You want more of that.
Well, and if you can have air quotes as much as you want,
exactly, because
never ending dopamine reward.
And because you were what we would say in air quotes, healthy, you were skinny and active. That was the thing. It's yeah, go ahead, eat 15 pieces of pizza. You can do it. Why not? If you can do it, you should do it type of thing.
You're going to burn it off when you play sports, so it doesn't matter.
And I think what is really difficult about this conversation too is doing that every once in a while isn't a horrible thing. Celebrating, having a whole pizza to yourself. But if you are taught to do this a lot, or that you can do it a lot, and you kind of, we were talking about earlier, you kind of shape your palate in a way to crave that sensation more. Or crave those tastes more.
Just having a really high tolerance and want for sugar, and it just feeds on it. It's not I just have a bunch of sugar every day and I'm capped that's too sweet. I don't want that. Eventually, you want the sweetest thing. You and I were talking about before the mic was on, I would get strawberry lemonade at the Cheesecake Factory. I don't know how much sugar was in that, but I loved it. And I can tell you now, if I taste it, that is a sugar bomb. I am disturbed.
Yeah. Because your palate is different now because you've changed obviously the ways that you're eating and the food that you're eating along with a bunch of other things since then. Yeah. It's this compound effect that we don't realize we could begin at one point in our life, and every once in a while, or one time isn't a bad thing, but all of a sudden, just in weights, if I have a person do one set, by the time they're doing that same set the fourth time, there's a compound effect of all the volume adding up, and it doesn't feel as good the fourth time around as it did the first. And the same thing with all this food,
my
all these decisions.
My coffee's not sweet enough.
Yeah.
Let me pour some creamer in there. Oh, my Greek yogurt isn't sweet enough. Let me pour some honey in there without measuring it and just dump a bunch of honey in it. And it's we start using healthier food as a vehicle to like for sweeteners. And that's kind of what I would do is I had to basically wean myself off of how much sugar I was having during my journey and realize, I was using coffee as a vehicle for dumping a bunch of creamer in because I was just addicted to something that tasted good and the sugar, and I just wanted more sugar. And then that put me on a bunch of blood sugar swings that I didn't know. So I would get hangry. And being hangry is not normal, by the way. So I would get hangry. I would feel like if I had lunch and then I sat in class for like 3 hours, this is in grad school, and then I'd want to go to the gym and work out, I would have to pack a snack because sometimes my blood sugar would dip and I would just feel weak and shaky and like tired. And I was like, I can't go to the gym. I feel like I'm going to pass out. So I need to make sure I have a snack. So I was like, my blood sugar was swinging so much. I think I would make sure I had something every 2 hours, which also is not normal.
Yeah. Did you ever have food as, I mean, some of our weekend warriors, I'm sure, can relate to this, but like as a reward? Like, was food ever presented to you as a reward? Like, if you win the soccer game, you get I love it, gotta have it at Cold Stone, or...
No, my parents never did that. They would just let me get the ice cream. They're like,
you don't have to win, you can lose.
No, it was not used, and I don't think I really viewed it as a external motivator or reward, but because I had like this food addiction where I was like, I love ice cream. I ran 9 miles in this game because they say you run like 9 miles in a game if you're playing like outside mid, and I worked really hard. Well, I can eat more calories because I'm growing and I'm hungry. So I'm just like, there's nothing wrong with having 2 milkshakes. I don't think I actually ever did that, but there's nothing wrong with having 2 milkshakes because I worked hard. That was more of like I think I used it as a justification. Yeah. Which maybe is still kind of a reward, but I wasn't like, if I work hard, I can do this. I was just like, I worked hard, I deserve this.
Yeah. Yeah.
So yeah, I mean, talking about all of like this sugar consumption and the skin conditions and stuff that I had earlier, like you are what you eat. I mean, it goes into your bloodstream, and so that kind of goes everywhere. And so if there's all this sugar in my blood over time, like it's going to shape my microbiome. No wonder I had like fungal yeast associated
your
things.
yeast were having a party. They were like, sugar!
Tinea versicolor, seborrheic dermatitis, like that feeds that microbiota. And like and no wonder I was sick all the time because sugar lowers your immune system. And
even just having your blood sugar should go up and down, yes, but huge spikes, roller coaster land where you feel like you can't even, survive or go to the gym or function without shoving food down your mouth, or you're gonna like fall asleep or pass out. That's a lot on your system just in general. Like your brain is like literally going, we're shutting down. We're not gonna work anymore. We're gonna operate anymore.
Yeah, and that creates inflammation, and never mind the fact that I was also just eating foods that I didn't know I was sensitive to, and that's also inflammation without the sugar. And once I hit puberty, all of a sudden, like, what do you think that does for conditions like endometriosis? No bueno.
Not good. Yeah. I think also it's so interesting to talk about food sensitivities because a lot of the interpretation right off the bat of a food sensitivity is, you should have a tummy ache. You should have diarrhea. You should be throwing up. And like, if those 3 things aren't happening, then you don't really have a food sensitivity. You know what I mean? Like that's kind of, maybe that used to...
You don't recognize it. Yeah, it's maybe that obvious.
Used to be the consensus. And now we're understanding like food sensitivities can show up in a myriad of ways. Like you said, like with, skin issues, with eye issues, with bloating, with... Nervous system. So there's a lot of kind of awareness that at least you can talk about. And I'm glad that we can talk about around food, because food is our fuel, that people can be more aware of. Some people might not even know, like I didn't even know. I didn't know that I was having a food sensitivity to dairy for a while until it got really bad and my body was like, you can't ignore this anymore. I'm turning your head into a tomato. So I think it's just a really good thing that we could talk about. And so I also want to mention this like mentality you had of just being an athlete, and like I can relate to this because I think I did this a lot with just dampen those signals that the body was giving me of like, I just need to push through. Like, it's not that bad. Did you think you were pushing through like that whole time in high school and like even in, I guess, through college and then it happened? Like, and then the break happened?
It's what's hard is like, so I would say to you, I don't think I was pushing through anything because I didn't know any different.
Because you didn't know any different.
But also, we're both high, like our personality and our just like nervous system is high performer. Mm-hmm. So I think you just do it regardless.
Yeah.
Like I didn't even feel like I was pushing through. Like that's like my baseline. Mm-hmm. So I thought I was fine. But yeah, the athlete mentality is really damaging because my nervous system was already like, without being an athlete before, my nervous system was already just like prone to the anxiety or just being, wired. Mm-hmm. So
do you have any insight to like why you think that? Like why you came, like why you think just baseline, you're a little bit more like higher vibration?
It's more of just a guess, but no, my childhood was fine. My mom will tell you like, she said I was always looking for something to worry about. I remember I was just like, I'd see storm clouds and I'd be like, oh, is there going to be a storm? Is there going to be a big tornado?
Somebody watched Wizard of Oz too many times.
No, it was like innate. Like I couldn't tell you.
I've never even seen a tornado.
It was like it was innate. And it could be because I'm a twin. I'm an identical twin. So like it could have just been stress of sharing, not having enough space.
Am I going to get the food or is somebody else going to get the food?
Because I've kind of heard that before recently too. Like twins are competing for or sharing. I guess you're not really competing, but you're competing and sharing the space. Mm-hmm. And so it could have been that like there's just not enough space for you. And so maybe that primed my system to just be kind of like that because my sister's also like that. Yeah. So we don't know why.
We don't know why.
We just are. So maybe that's where it came from.
Yeah. And then you become an athlete, which is, it just kind of, if that was like a smoldering fire, the athlete mentality of, a sense of control and this is your effort and this is your outcome and here's some gasoline for your anxiety fire.
Well, and like kids, you're becoming an athlete to, perform and maybe to play in college. And so that's its own separate thing. But like we all have to get good grades. Yes. So you're also stressed out about performing in school, performing in sport, and then whatever else your system is dealing with. Mm-hmm. And eventually, like I meet a lot of patients like this, and I know you're like this, I'm like this, but we get really used to these micro traumas in society, especially if we have this resting baseline of a nervous system that's more primed. And so you don't realize that you're stressed because to me, stress is like a car accident, a breakup, a funeral, like something really big and bad. Really your house catching on fire, like macro times 1,000
a loss of
trauma.
A loved one.
It's like, no, I'm not stressed. Like none of these bad things happened to me. Or like a C on a test was pretty stressful, but you're just constantly in fight or flight all the time at a micro level. Mm-hmm. And you don't even know it because that's just my baseline. Yeah. And I think a good way of measuring, like if you think you might be like that is if you have trouble sitting with yourself and like just relaxing, doing yin yoga, can you shut your mind off? Or are you always thinking about the next thing you have to do on your to-do list? Mm-hmm. Are you always checking your phone? Are you always air quotes on? Mm-hmm. And I think I've recently learned during this journey just how to actually come out of that. At least the first step is recognizing that you're living in 100% dysfunctional chronic fight or flight. Yeah. Because your system isn't getting a break. No. It really doesn't.
You're like Wi-Fi. You're just like always like like putting signals out there and you think it's totally fine and normal. And this is me to a T. I went through recently, I just traveled actually, and my flights got canceled. Like last minute, I had to like stay last minute in an airport and do all these things. And like in my brain or in my person, I'm like, this is fine. I'm just trying to roll with the punches, trying to make friends and make the best of the situation. But again, my system is going, alarm bell. We don't like this. We don't have our bed. This person's not going to be able to pick us up at the airport. This person's going to wish you could stay longer. This person is going to be disappointed that you're still going to go to this place at this time. Like, so my system is going into like, anxiety mode, stress mode micro trauma mode, but my brain's going, I'm going to be fine. It's fine. We're just going to pay with the credit card. We're going to do this. We'll stay at the hotel. And, you know, if you were to ask me, oh, like, were you stressed? I would have been like, absolutely not. Like, it was fine. Like, what are you talking about? And everyone's like, God, that seemed really stressful. And it's like, oh yeah, I have to recognize that, like, stress is not always like my leg being sawn off by a chainsaw.
My favorite thing too is that you take on stress that I don't is you're a people pleaser. So you also stress yourself out about making other people happy.
Exactly.
And I'm like, nah, I don't care. So at least I don't
It's
take
also
that
a different element. Just another thing to add to my stress bucket. But I did read something today and I thought it was really like kind of just on cue with what we're talking about, is that like good stress too, like, you know, whatever it is, getting married, having a baby, like good stress is also stress, or, you know, getting more clients at work or whatever it is. And because good stress is also stress, take care of yourself. And I was like, oh yeah, like, so even when things are going like so good, and even though I'm, you know, in an airport and I'm stuck, but I'm making new friends, and, you know, just that environment change is causing some stress in my body, which could lead to something else, you know.
And being
like,
on an airplane is a stress.
Like,
and you're not doing anything.
The flying fart can is not for
like,
me.
You get exposed to a little bit of radiation. Well, that's a stress. You get dehydrated because of the altitude. Yeah.
Like, I mean, you have a fear of flying.
There's all these stresses that you can't even see or that you necessarily feel.
Yeah. And those are all, just like we're talking about with the sugar, these are all like compounding things. So it's not like it's like piling up grains of sand. I would explain it maybe that way. Like, you know, at one point, that little tiny molehill of a grain of sand is going to become a mountain at one point if you don't do things to kind of flush those grains of sand out, or kind of like, you know, grade it down. I guess I would say that. Well,
even if you go on like a vacation and that's to, you know, dampen down your nervous system while I relax. But if you're eating crap that's you're sensitive to and you haven't changed that, well, you're still adding grains to that, even though your nervous system is fine. Like, you have to kind of balance everything. Yeah. And over a long period of time, being in this stress state isn't sustainable. So maybe you can do it for a little bit, but then when you hit this macro trauma, your system spikes up, and then you go back down to your constant micro, and then you get another macro. And so for me in high school, at least, this was just going on until college recruiting started. I don't know what it was. Like, my parents didn't stress me out about it. No one was putting pressure on me. Like, I put all this pressure on myself, and I would get performance anxiety, and I eventually just kind of burn out and crashed. So I got tired and wired.
That was like when you were being recruited?
It was, I don't know what it was. It was like right when freshman year hit, and recruiting doesn't really start till sophomore year.
Freshman year of high school.
Okay. When that started, I joined a new team, like the pressure was on. I was excited, but then like games would come up and I would just get I wouldn't be able to fall asleep. So then I developed chronic insomnia, and I would get like two or three. It was before games, yeah. And then when recruiting started a year later, it got even worse, because then you'd have tournaments and all of this other stuff. And it was basically like, I need to sleep this certain amount to feel good and to play well. And oh my God, it's like midnight, I haven't fallen asleep yet. And then your system is like, well, I'm not falling asleep, so that's stressful. And it's like,
and I know I need to get 8 hours of sleep, so I can
now
play
I can only
tomorrow.
Get 5 hours of sleep. Yeah. Well, you better fall asleep now, but I'm not asleep now. Now it's 2 a.m. And then when you are so tired, and then your body just makes you fall asleep at like 2 a.m., it's not really restful, because you're kind of on high, your system's on high alert for, you know, this lion that's not really chasing you, but your system thinks it is. And so your sleep is not deep. And then you wake up, and then you have to like do the thing. And then it's this cycle that kept going. And eventually, this was not diagnosed because I was in high school, but like, I think I had adrenal fatigue, complete adrenal burnout. Well, and I never got massive performance relax.
Anxiety. Yeah.
Yeah. And so when there weren't tournaments, I would sleep better, but my system couldn't shut off. It was just a constant, like, it was stuck in this state. And then I think eventually, this was like 2 years on and off. And then I couldn't tell you what air quotes fixed it, because nothing fixed it. It just stopped. And I think that's when your body will pump out cortisol for a certain amount of time, and it'll be high until it's like, I can't do this anymore. I can't even do it, yeah. And it just drops. And then you get low cortisol, which also screws with your immune system and stuff. So I think my sleep eventually, when I hit college and I wasn't doing recruiting anymore, I think my body was just like, okay, And it just, I don't know, it just bottomed out. And I was like, oh, well, that's weird. It just stopped, but I'm fine now. I'm good.
Even though it was more of like your adrenals were empty, your blood sugar was just constantly through the roller coaster roof, and your sleep was like, basically you're getting the sleep of, a new mother.
Oh my God.
3 hours of sleep.
Basically. And I didn't go to therapy. Like don't think that my parents just like let this happen. My mom was like, hey, maybe we should go to like a sports psychologist or whatever. And this was back in like 2010. So therapy was not cool.
And then again, just to point out, like you're talking about all this with a really good hindsight, right? Like you're looking at this whole scenario with like 20/20 vision, like when this was happening. And I can only say this because I know it would be the same for me. I can talk about my past with such clarity, but like when I was moving through it, I had no idea.
No.
Like, I had no idea like what I was experiencing.
And the doctors didn't know then.
No, it just wasn't something that you talked about. And like a lot of the stuff, like we said earlier, they weren't hidden symptoms. They just weren't bad enough where they were crossing that line of like, I need to go to the hospital.
You have to go to the ER.
Exactly. They weren't over that boundary line.
Well, when you're in high school, you don't want to talk to your parents about anything. It's like, get on my life.
I didn't want to talk to anyone. I wanted to like MSN
get out of my
Messenger.
room, Mom.
Yeah.
How was your day at school? Fine. So
did you learn anything? Yeah.
I didn't want to talk about anything. And then, therapy, like it was out of the question for me because if I went, then something was wrong. And nothing was wrong with me.
Yeah.
So I shut that door. And I think, I did not formally get diagnosed with an ulcer, but I'm like pretty sure I also got my first and only ulcer during that period.
So is that I'm sorry, I'm like blurring the timeline.
Like
Are we in college?
2011. No, this is high school.
Okay, we're still at the end of high school.
No, college things chilled out because I wasn't being recruited. So this was still high school. And then now I'm going to fast forward into graduate school where stress with the clinical rotations and this nervous system pattern that I've like painted the picture for everyone it kind of came back in a different way that I didn't recognize. So I was stressed out in 2018. We're in graduate school now. I was doing this intense sports clinical in Tampa and
I would not expect it not to be intense.
Yeah.
Well, mainly because our nervous systems they're pattern oriented. So you went from this pattern of being like highly stressed and your nervous system kind of operating in this certain way. And it was sort of like, that is going to be the way you're going to look to operate in the next thing you move to.
It's your pattern that you fall into.
Yeah. So
I had to move down to Tampa for like 2 months, and I ended up loving my instructor, but he was the owner of the clinic, and like they used to treat WWE wrestlers and like professional football players, and people were like, "Oh, you don't want to get him. He makes students cry." And
you're like, "I will make him love me."
He's lovable. Like we're great now. I still talk to him, but like he was this kind of cranky like 60-year-old man, and he was the owner. So I was with him from like 7 a.m. to like 7 p.m. And all I did was like try to learn so that I didn't make him mad, because I was it was my first orthopedic rotation.
Yeah.
And it was a mistake because he didn't want first orthopedic rotations. He wanted second and third.
Yeah. Experience.
He got stuck with me.
And you're like, well, I'm going to make this my mission.
And I'm like coachable. Like I want him to be happy, and I want to do a good job. And so I was stressed.
No people pleaser over here.
No, I know. I wanted to please like the coach. And so I was putting a lot of pressure on myself, and I wanted to like learn things, but I didn't want to piss him off. And then you're going 12 hours. And so I just, all of a sudden I got this new manifestation of a symptom, which was like right under my sternum. I got this, like, it felt like a jolt is the only way I can explain it, which now I know was actually stomach acid, like probably in my esophagus. They call it like splashing. So this chronic stress that I'd had for my whole life, and like my bad diet.
That you perpetuated unknowingly.
Yeah.
Because it's this pattern that your body literally searches for.
Yeah. So chronic stress lowers your stomach acid because your body's like, I'm not going to prioritize digesting this food. We're running away from lions. We don't have time to eat.
You don't have time to digest.
So it actually lowers your stomach acid, which I now have learned since through functional medicine, low stomach acid symptoms can mimic too much stomach acid symptoms. And they call it like, even though your stomach acid is low, you'll still you can get symptoms like splashing or whatever. And so that's actually what I was feeling, but I thought it was my heart. And it wasn't around eating. It wasn't around exercise. Like I looked into all the things and none of it didn't match up or make sense. And so I was like, oh my God, it's my heart. I'm having like an arrhythmia. And so my dad sent me this like portable EKG monitor, and everything was fine, but it would like freak me out because what else could it be? It's like right around where my heart is. Like this doesn't make sense. I didn't feel heartburn like in my esophagus or anything because I have felt heartburn before and it didn't feel that way.
Yeah.
And so then I went to a doctor in Tampa and he actually prescribed me omeprazole, which helped, which actually made my stomach acid even lower. But it did help the symptoms. And I was like, great, I'm good. Like, we're great. So now imagine this picture of my stomach acid is chronically low. I probably have this great imbalance with my microbiome from my diet and food sensitivities and all that good stuff. And now I have obtained omeprazole.
Yeah, so now
to lower my stomach acid even more. And probably adrenal fatigue with like low cortisol and my system.
Do you recall how your sleep was at this period of time?
It was actually fine. And that's why I said it was different. I didn't realize I was stressed because
you were sleeping.
It wasn't mimicking.
Yeah. Your symptoms were different.
It wasn't like sports performance anxiety. Like, no, it was just weird.
It was a different manifestation, like you said.
Yeah.
And then it's so funny to me, you like casually say that your dad sent you like a mini EKG machine. Your parents were both in the healthcare realm, correct?
No, I mean, yes, no. My mom's in healthcare administration.
Okay.
Nobody was a nurse or a doctor. I have nurses and doctors in my family, but like, no, my mom is an admin and my dad has a PhD in biology. So he worked with like viruses. Like, no, they were not in clinical roles.
No. It's just so funny. I'm like, I feel like that's like the last thing I would receive from my dad.
Well, I think my younger sister had like a scare too, and it was something else. It was like costochondritis, so like rib inflation. But I think they were something like that.
They were primed. Like, we're sending an EKG just in case.
Here, use this.
Okay, so now we've come a long way as far as like a little bit of your lifestyle and what's been going on. So we're getting closer to our wall. So what was this big wall you finally hit? Because we have like everything is piling up, right? Like this ant pile has gotta like we're becoming a mountain. So what was your wall? Yeah. Where everything where you finally were able to admit, okay, something is going on and like I need to stop. I don't know if it was a revelation or if you realize like part of this is like your nervous system or what was it? Yeah.
So when we were talking about the cardiac stuff, that was 2018. Okay. And so that just kind of, I stopped freaking out about it because all of a sudden the symptoms stopped. And then I just kept doing exactly what I had been doing. Mm-hmm. Except, now I'm drinking age. So like I'm drinking alcohol. We're putting alcohol in the fire because I didn't drink in high school. And all of a sudden, you graduate, yay, you find a job. And then 2020 hits. Mm-hmm. So this was like the pandemic hit about 8 months into me working at the hospital. Mm-hmm. And that was, we all know, that was massively stressful for everyone. But if you were deemed an essential worker in the hospital, which physical therapists in even rehab hospitals were, that is like, hi, you're going to be exposed to this and
you could possibly die. Or you could give this to a loved one and they could possibly die.
You better show up because you're essential.
Yeah. And show up.
And so, I'm constantly on the internet, like researching things. I'm reading news articles, whatever, because like I'm going to be directly exposed to this, possibly, probably. And that fight or flight, which I was always running on. We've already established that, but that's a macro trauma and it's a prolonged macro trauma. It's not like, oh, you got a C on your exam and you feel bad for a day or two, but then, you start studying more and you do better on the next exam and then you get an A. Yeah. But like, how long were we in this macro trauma for? I mean, it was just, you never got a break.
No. And there was a lot of loss of control too. Yeah. Like you said, like there was no, oh, I can just do this and the outcome will change with this. It was just like, I don't know. I don't know what the outcome is going to be. Mm-hmm. I didn't know I have to keep going to work. I know I have to keep showing up. That's it. You know, you don't know like when you're going to get exposed or what you're going to see.
How you'll react to it.
Exactly.
And so.
Or even, are they going to let physical therapists go? Are they going to let, am I going to become non-essential? Are they going to fire, like even like job risk is high.
I had a lot of classmates they were an outpatient and they got furloughed. So we knew that wasn't really a risk for us. They just started taking different kinds of patients.
Yeah.
So we all had work, which I'm grateful for, but yeah, it was just chronic stress. For me,
everywhere.
the stress was around the virus. It wasn't necessarily my job, because I think we all kind of knew we weren't going to get furloughed, but yeah. And then we had to wear masks all the time. And so, you know, that didn't bother me at first. It was fine. But then again, we're talking about like all of the sugar that I was like accustomed to eating. Like I was having food sensitivities. My gut's probably a mess and I don't even know it because I'm not in tune with myself. So when you're breathing into the masks and the air comes up towards your eyes, I was prone to developing styes just because of, I guess, the composition of my microbiome. And then I would get like chalazions, and all of a sudden, like it's called blepharitis, which is just inflammation of the eyes and the glands that make the oil so that you don't get dry eye. And then it never really went away, and it basically turned into it took months for me to figure this out, from bumping from eye doctor to eye doctor. I finally went to a dermatologist and said, is this ocular rosacea? Because nobody could diagnose it.
No one is diagnosing this, and I was
getting like vascular changes in my eye.
Wow.
Like you can probably still see, like, it's like your eyes, it's still skin. Like you have skin on your hands and your legs. Like you can get spider veins because it's still skin. So you can see, like, I've got.
You have one on your left.
It's always there because it was chronically inflamed, and the vasculature is just now present. Kind of like what you see with rosacea on your skin. You get the vessels become prominent, or I guess broken. I don't really have any on my skin anymore. I think that's healed. But yeah, it's like my eyes have that. And so
that's like if you're looking at somebody who smokes cigarettes their whole life and is 70 years old, you'll see their the vessels on their stuff. Yeah, you'll see all of that on their skin.
You can see it in the whites of my eyes. Like,
but you were not even 30 at this point, and
no, I was like 28,
not smoking.
29. Yeah, and it's just that chronic inflammation was like just a lot on that tissue, and so now I just have, and I don't have symptoms. You can just see it. It's like spider veins in your eyes, basically. So that's kind of what a hallmark symptom of having ocular rosacea is, and it's just chronic dry eye because of the inflammation, and it's horrible. Yeah, it's like I could not figure out what was going on. I was just like on the internet. I was like, I need to figure this out. I need to figure this out. No one could figure it out. No, it can for some people. Just because your eye's dry and you might get blurry, but no, it didn't affect my vision. But because I had all this inflammation in one area, so like my eyes were inflamed and my the facial skin was inflamed. I ended up I'd never had migraines in my life.
Did it cause headaches?
I would get ocular migraines, but now that when I would food log and figure out what was going on, I've realized it was certain foods that I was sensitive to were now ramping my system up even more. And I would get these horrible migraines like within an hour or two of eating whatever it was. At one point it was peanuts. I think I was just like
you were so like
I was reacting to a lot of things that I don't react to now or even did before.
You were like hypersensitive basically at that point because everything was heightened. So
it would be
your system, all the alarm bells are going off, and it's like, what else can I get? What other alarm can I give her? Peanuts? All right, we're gonna make it an alarm on peanuts.
Gluten, eggs. It was like I didn't
high allergen food.
I didn't, and at this time I didn't know. I felt like, why is this happening? It doesn't happen all the time. I can't figure it out. Like sometimes it would happen at like 2 p.m. after I'd eaten lunch at the hospital, and it was a slow roll. So I could work, but then by the time I got home, it was like Advil didn't work. Nothing worked. I couldn't watch TV because my eyes would be so dry. So like I just couldn't tolerate staring at a screen. Eye drops didn't work. Eye doctors couldn't figure out what was going on. And it went on for like months, and I was miserable.
And this is your wall.
This was my wall, and no one could figure it out. Like, here's a steroid drop for your eyes and an antibiotic, and this will fix you. And I was like, great, the doctor will fix me, because that's what I grew up with, not alternative medicine. Just you do what the doctor says, the doctor will fix you. And I didn't have any chronic stuff before that the doctor couldn't fix, or that didn't just fix itself. And this was the longest time, like nothing had gotten better. Yeah. And so I just ended up going down this rabbit hole of, I don't know what, I was probably just Googling rosacea or ocular rosacea. And I went down this rabbit hole of some people were talking about functional medicine and gut health. So this is now 2021. So this all started for me in like the summer of 2020. And it had been like 6 or 8 months of this. And then I found out about functional medicine early 2021, and I made an appointment with a nutritionist to like see what was going on.
Can you give a brief, it doesn't need to be thorough or exact, but just like a brief idea of like what you mean by functional medicine?
Yes. So I think a lot of people know what functional medicine is now because it's just like the internet these days. It's a hot topic. But functional medicine is pretty focused on, from my understanding, the gut. Like gut health, disease begins in the gut. What's your microbiome like? It's very root cause approach to medicine instead of like, here's a pill. Here, what I was getting before. Here's some eye drops for the inflammation, and here's an antibiotic, but it wasn't bacterial, so it didn't work. Yeah. So functional medicine's more of, well, why do you have eye inflammation? Instead of, oh, you have inflammation, let's treat the inflammation. Yeah. Why does she have eye inflammation? Because if we can figure out why and where it's coming from, then it'll get better. Which
I think also is just such a good point. Like, you know, they're the treatment of the immediate issue, like getting the eye drops, getting the steroid. If you're in the middle of an allergy and you need your EpiPen or you need your steroid or you need your Benadryl, like awesome, but deep dive. And I think functional medicine is what really actually takes that deep dive into these other areas of your life, which are maybe, you know, they're not so well understood because everyone has a different life and everyone has a different gut microbiome. Everyone has different tolerances and intolerances.
Things that started it.
In your childhood. Even interpretations of, you know, physical, emotional, psychological stress. Something that could totally stress somebody out might not stress me out literally at all. I don't know. I'm becoming more aware of what stresses me out now, but, and vice versa. So I just wanted to talk about that because it is functional medicine. It is a way to be an advocate for yourself, but I don't want to say, oh, we don't need this other form of medicine. Like, obviously we need it.
Yeah. I still have a primary care physician. I still get my annual physical.
All
I'm
of
not
these
like
things
off on this, like,
no.
screw Western medicine. Like,
I don't think that at all. I just wanted to make sure, like, we kind of also just like address that. But I think the self-advocation you had and taking on and going down this functional medicine rabbit hole is kind of like really what propelled you towards a healthier version of yourself. Yeah, it was like something is clearly not working. These people can't figure it out. What else can I do? And I did end up finding, in addition to the nutritionist, I did end up working with a dry eye specialist. So I was using Western medicine in conjunction with functional medicine because that's what we were probably what needed to happen anyways. It's probably what needs to happen with everyone, you know? Yeah. So I worked with him and then I had a nutritionist, and really what I booked a nutritionist was because I have enough of an understanding of medical terminology. And so I was really looking for a guide who could say, let's do these labs, let's do these supplements. Like, I'm not going to try and just treat myself, or, you know, I didn't want to shell out too much money, and I could kind of collaborate with someone. So I looked for a nutritionist, and we did a stool test, and surprise, we found gut dysbiosis. So just an imbalance in beneficial and bad bacteria. I did have leaky gut, which is intestinal permeability that can be caused from stress and all those capacities. And then that would cause food sensitivities as well. And because then usually what will end up happening is through that leaky gut, because you have that permeability, some food particle or protein can get into your bloodstream, and then your body goes, what the fuck? Yeah, it'll be like, this is like an invader. Haywire, I need to attack this. React to it. And I had low secretory IgA. So secretory IgA basically is the immune mediator of your gut lining. And cortisol, your stress hormones, if you're chronically stressed all the time, cortisol suppresses the secretory IgA. So that was an issue, and that also was not helping my immune system fight off like any of the pathogenic bacteria that I had or all the other stuff, or it was causing me to have the food reactions. And it just basically low secretory IgA can cause increased susceptibility to infections, dysbiosis, food sensitivities, and gut inflammation. So that is what we found. So during this time, I just want to sidebar a little bit, but were you working out at all? Well, no, it was COVID. No one was working out. I mean, I was working out in garages, but.
Yeah, and I wasn't running because we're going to get into this in part 2, but like 2018, I had this knee kind of injury. And so I wasn't running.
Yeah.
And I did eventually start doing yoga in place, but during this period, I might have been, but at first things were shut down. And then you had to go to like Planet Fitness in a mask. So I was just like, screw this. I'm not doing this. So I don't think I didn't have a routine by any means. And that's how I would de-stress too. Like was through running or working out, and like,
you didn't have that access
point. If I don't remember if I was doing a little bit, but like it was not routine.
Not what you were used to.
No. And I was getting these headaches. I was symptomatic. Like, so no, I really wasn't, I don't think I was doing much, honestly.
Yeah.
And basically, so we found these things on the test, and then I had started before I found her because I had gone down the rabbit hole. I did like a self-directed elimination diet for a few months prior, and I just continued. She said, well, you've done a good job, so just continue it on.
Yeah.
So for like 3 to 6 months, I was basically paleo.
Yeah.
Because it's dairy, really clean. Gluten. Yeah, paleo is basically like the caveman diet. So you didn't have grains in caveman days. They weren't growing and making like bread, right, or wheat. So there's no grains. There was no legumes. There's no dairy. There is eggs, which I found out later I am sensitive to. So I did paleo for a little bit, and I was like, this might be helping. I can't tell. I thought maybe it was no alcohol, and then it felt like something was missing. So then I was committed because I was so miserable and desperate that I went autoimmune paleo, which is paleo minus nuts and seeds and minus eggs. So that's how I found out that I'm intolerant to gluten and eggs, and I think peanuts flared me up when I was really inflamed.
You were on like meat,
vegetable, fruit, coconut yogurt. I did find some good alternatives like coconut yogurt, but yeah, and coming from the diet that I had before, like standard pure American, sugar, eating whatever I want, like gluten, that was so hard. And
the bread base on the triangle.
It was so hard. And I was like, what do I eat? And I was craving sugar. So I was like, let me make a bunch of sweet potatoes. Can I make like paleo sweet potato pancakes because maple syrup is technically like acceptable. So I was trying to find ways to do that. And in doing all of this, I was also tracking my symptoms. So I started food logging with this. It's actually an awesome app. It's called Chronometer, Cronometer, Chronometer.
It's a food tracking app.
Yeah, and I still use it sometimes intermittently, but I basically used it to track symptoms and just what I was eating because I figured I was reacting to food.
It was a way you were food journaling.
Yeah, and by proxy, it tells you, oh, these are your macros, these are your micros. It tells you how much sugar you're having. So when I was doing this,
how many grams of sugar
I realized
was estimating for you?
I must have been having like, before all of this happened, I was having upwards of 200 grams of sugar. I am sure of it. Between like the lemonade that I said, the Cheesecake Factory lemonade, and like a cookie and whatever else, you're eating. So I was really disturbed. And then I tried to look up how much sugar are you supposed to cap out a day. And there's no recommendation. There is no recommendation.
Yeah, there's no, which I think is, I can understand why there's no recommendation, because there's days where I intentionally consume more sugar because of my activity level, and then there's days where I intentionally consume less because I don't need it. I'm doing an endurance race, so there's days when I'm paddling upwards of 20 miles just for practice, on top of coaching 6 clients a day and running a business and cleaning a gym and all the other things. So I know my body needs, I can't eat enough volume of carbs that don't have sugar in them to give me the amount of energy. So having stuff that has sugar in it allows for that extra energy to be kind of packed in without as much volume, because I can only literally put that much food in my stomach. So I think there should be maybe like a baseline of like, this should be a target amount.
Yeah, you don't want, it's not like zero. Like your brain needs glucose to function. So
like maybe somewhere between like 25 to 30, 40% of your body weight max. I don't know. I mean, it's kind of hard to tell, but
I just made the decision.
Arbitrary number of grams, like under 50.
I just made the decision. I preset all my chronometer stuff, so now I try to make sure that I'm not really surpassing 50. I mean, it happens sometimes because like I have a banana and then I have something else, but
Well, yeah.
50 is kind of my cap, but imagine I was probably having like, if you have like 3 drinks of alcohol and then you eat a piece of cake, like who knows how much you're having.
And like mainly we're talking about like
grams.
added sugars.
Including,
added sugars.
Yeah, so...
Because fruit is going to have... I mean, a lot of things have, like, a base of sugar. Like, a sweet potato has sugar in it. Like...
Yeah.
Which is why...
I still keep it at 50.
Yeah.
I know I've heard through other podcasts, added sugar, you want to cap your added sugar at, like, 24-ish, 25 grams a day. I just try to not really have added sugar if I can help it. I get enough without it being added, which is disturbing, right? So... but beyond figuring out what I couldn't eat, I basically was able to give my body a break from all of the garbage I had been doing. And I didn't drink alcohol for like 10 months because I was that's how committed I was. I went to 2 weddings and did not have any alcohol because I didn't want to feel bad with my eyes anymore. Like I couldn't wear contacts and I'd worn contacts my whole life.
Well, I mean, alcohol is one surefire way to really screw up gut healing. So if you are, contemplating this journey to heal your gut, you will have to not minimize, you will have to eliminate alcohol for a quality amount of time. I would say at least 30 days, if not up to 90 days.
Yeah, I agree with that.
In order to really like get a benefit out of doing that and actually start to heal that gut process.
And for me, I went from like 0 to 100 with that lifestyle change. And it's, if you're just a normal person listening to this, and you don't have too much going on, like, it's a lot, but I was super motivated. I didn't want to feel bad anymore. I just wanted to take control.
Well, you
and
probably felt like you can't work, you can't function. Like your
I was
are
miserable. Like I just
day.
wasn't happy.
Yeah.
Like it wasn't even just I can't do this, I can't do that. I was like I can't exist. It was really hard. I would wake up with dry eyes in the middle of the night and have to put eye drops in. Like it was impacting everything.
So you began with the gut. Or whatever. The gut was like kind of at the forefront of all of this. What were some things that you started to implement to help your nervous system recover? Because obviously that had to play a role. Like you didn't just heal your gut and go, I feel great. Let's do the same thing over and over again.
It wasn't just diet, which I will say, like, because I was always looking at how red are my eyes. That was kind of my metric.
Litmus, that was
I would look in the mirror. How red are my eyes? How red are my eyelids? Can I see the veins?
Do I look like I just smoked a pack of cigarettes?
No, I didn't look like that. It was different. But I was already kind of doing yoga on and off, and so I started going to yin yoga. And that just really, for me, I can relax. Somehow I can relax in yin yoga. I don't get like impatient or bored. And it would just take me out of my mind. And I would get in the car after. Yeah. And I would get in the car after and I'd look in the mirror at my eyes and I'd be like, I think that helped. I think that made my eyes better. Like there was a specific instance where I was driving to yoga from work and there was like this person being an a-hole on the road and I had like this road rage, like surge of emotion. So it was anger. So like my eyes got really red because that was stress. And I was like, oh, now I'm going backwards. My eyes looked better before that. Like, are they going to go back down? Or is it like, now is it flared? And then I went straight into yoga and I came out, I was like, oh my God, they look better than they did even before the road rage incident. And so it was 100% a combination of nervous system and the gut stuff, because I mean it's all interconnected too. They play off of each other too. So yes, yin yoga, meditation, trying to just take my system down.
Did you practice any, this is just me questioning you, but like did you just practice any like self-talk? Because I've noticed, I mean maybe at one point I'll be able to share my story. I'm very new to kind of like healing myself, but I notice now there are times when I kind of get ruminating, like you were saying, of, something will happen and I'll be like, oh my God, I'm making this symptom worse. I'm doing this and it's bad for me. And then I find myself like spiraling around it and I'm like, okay, slow it down. Like just keep doing the things that you're doing. And then I find myself, okay, like I kind of almost have to like mantra myself out of maybe this pattern or that, panic that my nervous system is like craving. Like it's craving that like, I need you to feel a little stressed out right now. And I have to like mantra myself out of it. Did you have any self-talk or any like mantras like that pulled you back down or back in? I
didn't have mantras, but I will say like I would have to kind of bring myself like pause what I was doing and bring myself into the present. And this is what I've talked to some other patients who have like this nervous system overdrive and they're dealing with weird symptoms like this, is I would feel like I needed to, if I could learn more information on this or find something else online, then like I could take control and I could make it better. And being online and like going through forums, whatever, it always made it worse because it just stresses you out and it puts you in a bad headspace. And all the people who post on these forums are miserable and trying to find answers. Like when you're good, you're not going to go like a year later and post on a forum. Some people might, but like you're not going to go be on these forums when you feel good.
You're outside looking at the sun.
You're enjoying your life. You're not miserable. You're not staring at a screen. So it was more of like, don't grab the phone. And we're already addicted to grabbing the phone. So it's in your hand for no reason already. And then all of a sudden you're just on the internet. So for me, it was more of like reminding myself, you're not supposed to be doing this.
Yeah.
You don't need more answers on this. Like you're doing the right thing. Like it's more of, it's hard to see when you're in it because you don't know where the light at the end of the tunnel is and you haven't been through it before. So you just have to trust the process and be consistent.
Yeah.
Like I didn't know if what I was doing was really working. Like it helped, but I would say you give everything a season.
Yeah.
So every 3 months I would look back and I noticed, oh, it is better. Oh, it is better. And pretty much like from 6 months on, I would say, oh, this is helping. This is working. I'm making progress. But it didn't stop quickly after 6 months, right? Like I would say I even noticed improvements up to 2 years after. So 2023, when we were getting married, like I was still being very careful about certain things and didn't want to backslide because I'd come so far. And I would still like, oh my gosh, I still made progress in the last 3 months. This is crazy.
Yeah.
And I wasn't being a stickler I was not paleo for 2 years. Like I reintroduced foods and I learned a lot about it. And my nervous system was good. And I was doing other things. Like I wasn't just a committed hermit for 2 years. I don't want people to think like, well, you got to do this forever.
It's too much of a commitment. I'd rather just be unhealthy or I'd rather just deal with my itchy cheek.
You just have to put in, like I had to put in the work to build this foundation of like not being inflamed. And then your system starts to tolerate stress better as you put out the fire. But you can't just put stress on the fire while it's there. I mean, you're just going to keep basically ripping the Band-Aid off and opening up the scab and reigniting the cycle. Like there is a level of patience and consistency that I had to learn.
Yeah. And I think this kind of like talks about, or this speaks to the topic or the subject, the title of this podcast, of it being like a hard thing, like healing. And it's not necessarily this big, burn the house down thing. It's kind of these small, challenging decisions over and over and over and over again. And then maybe allowing yourself to like veer off the path to enjoy a vacation and then coming back to those same decisions over and over again. And also just having the mental fortitude to want to heal your body and not get sucked into, well, I'm just going to be like this forever. Or, oh, I'm just going to deal with this symptom. Or, because things can be so much better on the other side.
Yeah.
It doesn't necessarily, unfortunately, I do think actually we, especially if you're of the same kind of mindset we came from, this athlete mentality, performance mentality, or high performance mentality, sometimes the body has to really shut us down before we start to listen, but it doesn't always have to be that. And you can kind of start to make these little really evolutional changes, but they're just tough decisions, but they're small. They're, going out to dinner and ordering, the blanched vegetables and fish, but you're still, squeezing your social life sponge. They're tough decisions and hard things that it's not going to leave you necessarily on the ground feeling like I need to be in the fetal position that was so hard, but they're hard because they're not necessarily the decision you want to make. Yeah. But you make it because you're tapping into that mental fortitude of, I want to heal my gut.
Well, it's like about being resilient too. Like, do you have you have to have a level of resilience, because if like you go on these forums for like people who have ocular rosacea and they'd be like, I've been having this for 5 years. I've had this for 10 years. And it's like, you can kind of tell the vibe of like, I'm a victim of life. I need someone to rescue me type thing. And it's like, I just didn't want to be a victim.
Yeah.
Like I was just like, why don't let me just try this thing and be consistent. And a lot of it was nervous system work and diet. And like, I didn't have I wouldn't say positive self-talk, but like being positive and figuring like, I can do this. Like, I think like this isn't going to always be this way.
No.
And I did end up like, I don't have it anymore. I can wear contacts again. Like I wear makeup. Like I can wear contacts for 14 hours. I don't have dry eye anymore. I don't use eye drops. Like I'm not just babying it or anything like that. And I've reintroduced a lot of practices and foods and like I can eat. I mean, if I eat gluten, I don't have gut stuff. I just get that brain fog again.
Yeah.
But I don't eat gluten. So it's more of like I've adopted this healthy lifestyle that I probably should have always had anyway. So it doesn't feel hard because I feel good and I know like I'm just doing what I need to do for myself.
Yeah. What do you think, like, do you think that the giving up the gluten was the most transformative, hard thing you did? Or what do you think what was the most bang for your buck, I should say? What was the most transformative, small, hard thing that you've done?
I think if this happened 20 years ago, gluten would have been the hardest, but now it's so easy with all the people who have gluten sensitivities.
And,
like
there's a lot of gluten-free things.
Yeah, I could just go to Whole Foods and get cassava pasta, brown rice pasta, so gluten-free pizza. It's pretty, that was easy enough.
Yeah, because you could sub out. You could do that Indiana Jones change out. Or I'm going to do this pasta instead.
So for me, it was actually, I think, it was cutting out alcohol for so long. And even though, alcohol helps me have fun at weddings or whatever. And I went to 2 weddings without any alcohol.
It's a good social lubricant, that's sure.
I felt so good though. Like my sleep was never impeded because alcohol is terrible for your sleep. I didn't have like that extra sugar or the blood sugar crash or anything. I didn't have the food cravings. If you drink too much, well, you want to have something savory or maybe you want a pizza. And then your decisions aren't as good with what you're doing. And I got to a point where I was just like, if I didn't have to drink again, I just don't think I would. But now I drink socially. So, clearly like I came back to it, but that was.
But it's also, again,
I felt so good.
Like we talked about these being tools. So if you're living your life, you're doing your social drinking, you're eating your foods. If you came up against a flare up, you would probably I'm just going to cut out drinking. Yeah. And then maybe I'll switch up. Maybe I'm having a reaction to a certain processed gluten-free thing. Maybe I'll remove that item from.
I'd say it's like
so now you have a tool.
It's like 80-20 rule. Like 80% of the time I'm doing all the things that I know I should be doing, but like 20% of the time, like, I want to go have a drink with my friend or we're going to do this on vacation or whatever. But I actually did so I would say 2023, I was like pretty much good. But last year, 2024, I did have a little bit of an eye flare. And it's funny because I was just like, I can have all these gluten-free subs now. I'm not eating gluten. It's fine. But there's still like all these things that are in it. What you get at a restaurant, you don't know what they did to it or whatever. So I was kind of, air quotes, bad for a little bit. We had just gone to like Europe and I was having like wine and cheese and all this stuff. And I had like a bunch of gluten-free subs over the course of a week eating out. And I just felt this weird pain, ache in my like right lower abdominal quadrant, like probably my right lower intestine. I thought it was my appendix for like 2 days. I was like, oh God, like if this doesn't go away, like I might have to go. Like, is this appendicitis? Like, please don't let it be. But it's funny. If I looked in the mirror, my left eye got red. At the same time I was having this. And I was like, oh, this is my diet. And I thought, should I go to the dry eye doctor? I hadn't been to him in a year. I was just like, I didn't need to go anymore.
Yeah.
And I thought, well, if this doesn't get better, I'll go see him. I'll make an appointment next week. But in the meantime, I'm going to scale back. I'm going to go straight back to paleo for like a month, 3 to 4 weeks. And I'm not going to drink alcohol. And we'll just see if this gets better. Yeah. And it did. I didn't go to the eye doctor. I learned the lesson. I have the tools now. So I feel like I can manage it.
Yeah. I think that's the really like the important thing about your journey is that you're able to recognize some of the symptoms where it doesn't need to get this bad. You can go, oh, something's happening. Let me like reach into my toolbox and then pull out this tool.
You don't spiral. Like I think I'd want to spiral and be like, oh my God, like it's back. Like, what do I do? And that's like that victim mindset. And it's like, no, you know what? I feel like I got a handle on this. Like I came out of this and like, I can actually do this without calling anyone for help.
100%. But
I have someone if I need them.
Yeah, exactly. And you may, which is really cool. So, and I do kind of want to like tie this in because you ended up using basically kind of like this Eastern medicine approach was that because you exhausted everything else and like trying to resolve your issues? You were just like, I have to do this in a way that's going to be not only like get to the root cause, but I think it is also something that you identify with as your own core values. Because I watch you deal with your clients, and that's your principle, is like, you're not just addressing this one thing, like you're addressing this root cause. I guess my question is kind of twofold. Like, did you look for that, or was that a result of being so exhausted with the other thing? And then do you identify with that type of practice and how you treat?
Yeah, so now we're moving into like phase 2 of a systems healing. So with functional medicine, the gut gets a lot of attention, but they do stuff with hormones too, right? Like they have the Dutch test. Certain practitioners will do the GI map and the Dutch test. And so during this whole health overhaul, I was listening to podcasts on my 30-minute commute to work. I was just like, how much can I learn? Because I need to like know how to fix this, and I just want to learn more about all of us. It was fascinating to me. So I pretty much came across material where it was like, oh, hormonal birth control is not great for you. And I was on hormonal birth control. So I had been on it for 9 years, and I was just, if I was going to do the whole health overhaul, like I was learning, that if it can affect your gut, it can affect all these things, like it can cause all these problems. You're not having a real cycle. You're not, like, your hormones are off, and that's a vital system for women. Like you get your report card every month, and like it tells you how you're doing. And I wasn't they say, like, don't they say your period's like your 6th vital sign or something?
Yeah, it is. But we didn't learn that.
I learned that on podcasts.
Yeah, we did not learn that.
Yeah, they don't say that in school. They don't say that in physical therapy school or medical school. I learned this on Spotify University. But I decided, if I'm doing this overhaul, like let's also do this. So this was now like 2021, still 2021, after like I was doing the diet and the gut stuff, and now I'm like, what? Let's prepare to figure out how to get off of this birth control situation. Yeah. So I did, and my cycle came back like within like a month or two. So it seemed okay, right? And then a few months went by, and all of a sudden, like, I caught COVID in January 2022. So that was a big major stress. I don't know what that did. I went on antibiotics for something else, like a pretty intense protocol as part of a gut thing. And then I'd picked up hot yoga. I was like, well, if I'm not running, I'm not doing all this stuff.
Hot yoga?
I was going to hot yoga 5 days a week. It was hard. Like power yoga. You were sweating. It was like 90 degrees. So like you were basically in a sauna with a bunch of other people, and I was doing that 5 days a week, and I felt really good. I was like, I feel great.
Did you pick that up and drop the yin?
I don't think so.
Still doing the yin?
I probably wasn't doing yin as frequently as I should have, but I didn't I still go to yin. I don't think I ever dropped it.
You never dropped it. Okay.
But I just picked up like, I'm going to do this 4 or 5 days a week, which is, even though I felt good, I was like burning myself out. So like all of these really intense things came up at once, and then my cycle just disappeared. So it's funny, after the pill, it came back a little bit, and then it went away with all of these stresses. And I was like, oh, well, let me just track it. And then it was gone for like 4 months.
Wow.
And I thought, okay, I guess I'll go to my primary care physician. She ordered labs. The labs it was not obvious what was going on. Like my testosterone was like mildly elevated, but if you do female hormonal labs, you're supposed to do them on the 3rd day of your cycle. Yeah. But I wasn't having one, so we didn't know where I was. So we didn't have much information.
You're just kind of like shooting from the hip.
Yeah, nothing was screaming. We didn't know where I was at. Yeah. So then she said, okay, well, why don't you go establish care with an OBGYN, and you'll figure it out. And I thought, well, they'll probably put me on birth control again, or they'll give me something synthetic. I don't want a medication. Like, what are they going to do for me? So then I don't remember if I like researched some stuff, but I did talk to my functional medicine provider, and she just I think she was more into the gut side, that she didn't feel like maybe she was going to be able to give me the best answers on the hormonal side, which I appreciated her being honest. So then I was like, I found out about acupuncture. I might have looked it up. I can't remember. And so I decided I'm going to try acupuncture for a few months, depending on what she tells me how long it takes, maybe 3 months. And if it doesn't get better, then I will go to the OBGYN. So I'm not refuting Western medicine here.
No.
I'm just like, oh, let's
explore.
Let's try something first.
Let's explore.
It's not an emergency.
Yeah. When you say acupuncture, could you give us a little bit of information on it? Because I think a lot of people just think it's like, oh, they just poke you with needles, like, or they just put needles on your skin.
Yes. So I'm obviously a physical therapist. I'm not an acupuncturist. We're not trained in acupuncture. But my understanding is acupuncture functions on meridians that are connected, that connect the acupoints, and the meridians do different channels. So there's like a liver channel, there's a pericardium channel, there's like a lung channel, and they will activate different points based on your pulse reading. So she checked my pulse and felt like, oh, I had a blood qi deficiency, and I think a kidney qi deficiency is what she said. So there's a kidney channel, and they can feel all these qualities on your pulse. It's not like when you go to the doctor and they're like, oh, this is your heart rate. Yeah. Oh, you have a pulse. It's like, is it slippery? Is it fast, slow?
Yeah. What does this beat feel like?
They can feel different channels in it. It's crazy. They can see like, oh, there's a wind deficiency or whatever. And so I worked with her. She told me to take maybe 3 months for it to like come back. We just see. And I think basically it works along like your neuroendocrine system. So I love it for hormones. And I worked with her for 3 months, and the cycles did come back. But everything takes time, right? So they came back, but they weren't like 30 days. It was like 50 days or 60 or 40 days. And it was just, my body was figuring out the kinks. And so I did end up going to my OBGYN within that 3 month period because they came back, but it wasn't perfect. And I was like, okay, I give myself 3 months. Yeah. Let's just make sure it's not PCOS or something else that he needs to treat. So I did make an appointment. And the wild thing is because I had cycles, I could now get my 3rd day labs done. So we could figure out what was actually going on. And the labs were perfect. Yeah. He was like, these are perfect labs. There's nothing wrong with these labs. Yeah. So I would give a testament to acupuncture because pretty much if I'd stuck with it, my body would have normalized. It just takes time. And a season was 3 months. Well, if I gave it another season, they would have come back evenly anyways. Yeah. So the labs were perfect, but then he said, well, let's do an ultrasound, make sure you don't have PCOS because we need to see if there's cysts on the ovaries. And I did that, and there were not I didn't have PCOS, but there was like something mysterious that the ultrasound couldn't pick up because ultrasound picks up fluid and there were like hard parts to it. So then I had to go get an MRI, and I had like cancer labs done because they didn't say what it was. They just said, oh, get this lab work done. It said like CA, like whatever the number was. Yeah. And I looked at it, I was like, these are cancer labs. And I was like, oh my God,
what's happening? Yeah. And it's good though. It's good that you had that.
Yeah. So.
Because ovarian cancer can present without symptoms. So it's really good.
Yeah. So I go and I get the MRI done, which is stressful. Yeah. Because you don't know what's wrong. But the labs were fine. Yeah. There was nothing wrong with the cancer labs, no cancer. And it was a benign tumor or a type of cyst. It's called a dermoid cyst. And the crazy thing about these cysts are, well, they form in utero. So it happened while I was born with it. And I didn't know it. They actually don't cause any symptoms. So this cyst was not a root cause to my hormonal issues or anything like that. It was just coincidentally found with everything I had going on with the journey I was going on, which is great because it turns out it was twice the size of my ovary.
It's big.
So it was like 6 centimeters. Yeah. And usually these only cause symptoms by the time they get to like 8 to 10 centimeters because they get so big they flip the ovary and the vessels, like it twists around on itself, and then you get all this intense abdominal pain, but you don't know why because you don't know what's happened. So you go to the hospital and you get an emergency surgery, and usually at that point you lose the ovary. They just have to remove it.
Because it's been twisted.
Yeah, the blood supply's been cut off. It's ovarian torsion. So I was really lucky that I had no symptoms, and we like found this.
And you found it.
Slow growing.
Because none of that happened to you.
No, and you're not born with it at 6 centimeters. So it grows very slowly over time. So who knows? It could have flipped in 2 years. It could have flipped in 20 years. Yeah. And we found it. And so, we found it. But all of a sudden, like 3 months before my wedding now, I'm like, I need to schedule this surgery. And I looked at him, I was like, can I wait? And he was like, I mean, I wouldn't recommend waiting because we don't know.
Yeah.
We don't know the rate it grows. We have no idea. And so then I would go through phases of like, oh my God, like this is gonna explode.
Is my ovary
kill
twisting?
My ovary. I was like, no, I need to get this out. I was like, but I don't want to have surgery. Like I had to have abdominal surgery. It's a laparoscopy. Like it happens. It's really common, but like it's really scary when it's you.
Yeah.
Signing up for surgery because there's all these things that could happen.
Exactly.
And I'd had elbow surgery when I was 5.
Everything becomes a little bit more real when you're facing it head on.
Like I had surgery when I was 5 for like a broken elbow, but like it doesn't mean like, oh, I've done this before. Like it's still terrifying. It's like all your vital organs are in there. And we didn't know if he'd have to take the ovary out or if he could save it. And so we did that, and
So you did it before the wedding.
I did it in, I think it was January 2023. And my wedding was in April 2023. And so we did it, and he saved the ovary, and yay. But now I've gone through abdominal surgery. So like I have all these tiny little scars, and it's like, so I know what it's like to go through an abdominal surgery.
It only makes you a better PT.
And also the irony of all of this was because I had a laparoscopy is also the gold standard for diagnosing endometriosis. Otherwise, like you just kind of guess you have it.
Yeah.
You have to have a laparoscopy if you are going to get diagnosed,
Can you
I don't recommend doing.
Can you explain endometriosis really quick?
Yes. So endometriosis is basically lots and lots and lots of inflammation in females, like pelvic area, their reproductive organs. There's a theory that there's an autoimmune component to it. Yep. It creates a lot of scar tissue. So,
and you can experience the pain. Yeah. Like you could experience back pain. You could experience cramps.
Everyone experiences it differently.
Yeah.
So
it doesn't manifest the same in everybody.
It can cause scarring in your tubes. So it can cause fertility issues. It might not though. It can cause really heavy cycles. It can show signs of like you could have clotting, all of this stuff, lots and lots of pain. You could have pain like not on your cycles. Everyone's different. And I didn't know that I actually had it in high school because I would look at all the other girls around me and be like, well, they're doubled over and I'm not comfortable, but I'm not as bad as her. So this is normal because they teach you in school, oh, yeah, it's normal. And you're with all these girls. And I'm like, yeah, my period sucks. Like this is normal. So you're like, yeah, what I'm dealing with is normal. And it turns out like when he told me during the follow-up, he's like, well, I saved your ovary, but also you have endometriosis. And I looked at him like, I was like, no, I don't. What are you talking about? Yeah. Because I have no symptoms. I was like, I'm regular. I don't have any problems. Like my cycles are 4 or 5 days. Endometriosis, they could be 7 to 10 days. Like it's not normal. And I have no pain, which if you're having good cycles, that you should have absolutely no symptoms besides the fact that you're bleeding. Yeah. Really. And they should be 4 or 5 days. And he was like, well, you do have endometriosis. You have scar tissue. Yeah. And I was like, can you tell how old the scar tissue is? And I was just curious because then I started wondering like, oh, is that what I was feeling in middle school, high school? Like, can you tell if it's old? And he's like, no, not really. You can't tell.
Yeah, I think like once the tissue is like scar tissue.
There's adhesions around your organs. Tissue, you can see the adhesions. Like it's not inside your ovary. It's like adhesions all around the organs and like in your abdominal wall. And so then we were talking through it and I thought, oh my God, wait. So what they say is when you come off of the birth control pill and your cycles come back, they're supposed to be just the way they were before the pill. So I was expecting them to come back and be the way that they were. And they were fine. They came back so much better than before the pill. Yeah. Because first of all, the pill masks it. So I didn't have these symptoms
when you were on the pill.
I was like 18.
Well, because a lot of people are prescribed the pill
for it, right?
For endometriosis. I think because of
the symptoms.
Because of the symptoms, and it mimics pregnancy in your body. And also people are also like not encouraged, but I've heard that like you can get pregnant to help relieve
I've heard that too.
Your symptoms of endo. So of course being on the pill and having the pill be something that like kind of tricks your body into feeling pregnant every month is something that would mitigate those symptoms for sure.
Yeah. Well, and then basically we found out, okay, well, I forgot about it because being on the pill for 9 years, I didn't notice anything. Yeah. And because my cycles never came back as bad as they were, I realized, oh my God, this is because a few months before or a year before I came off of the pill, I completely
you eliminated everything.
Eliminated like all of the foods that were triggering. I revamped my nervous system. I've like worked on my gut. I've cut out like all of the junky chemical like
processed foods.
Tide Pods, stuff in your house, like candles, like all the toxin endocrine disruptors. Because all of those chemicals can mimic estrogen in a woman's body and just like also mess up your hormones. So I had done all this recon, and now I've come off of the pill and I'm having normal cycles again, and I have absolutely no signs or symptoms of endometriosis except what he found on the laparoscopy.
Yeah.
So
like if he never told you that, you wouldn't have that even in your brain.
No. Wow. No, it never occurred to me. So
oh my gosh.
It's very interesting. But yeah, there you have it with like diet, commitment to like diet, stress management, complementary holistic practices, like acupuncture and functional medicine. I've gotten my dry eye, my gut inflammation, and the endometriosis like into, I want to put air quotes like remission ? Because it can all come back out. If I fall off the wagon and I start eating like crap and being stressed out and not taking care of myself, like I'm not going to have a fun cycle. I'm sure the endometriosis will start to like knock on the door again and talk to me. So
well, so it's part of still being in this healing journey. I think we've come so far and we've talked about so much. We've covered a lot.
This isn't even everything.
A lot of your background information.
This is just part one.
Yeah, I know. In summary, I guess now we've done the systemic part of your journey. We've talked about your nervous system, some of your thought processes around it, your hormones, healing endo, healing your gut, healing your dry eye. And we still need to cover some of the other physical side of what you have been healing yourself from. So I think now is a great time to take a little pause, and we're going to come back. There is more here. We gotta keep doing our deep dive. We're still going down your health journey. So we're going to come back. We'll have an episode. We'll have a part 2 of this, and we're going to talk more about Hanna's health journey and more of the small but hard things that she did to, overcome any of the things that are keeping her health in the red and having her stay in the green. We'll see you next time on
Beyond the Reps, what your trainer and physical therapist forgot to tell you.